Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Southwest Florida, Fort Myers, Florida. Here with an amazing young person, Carolyn, who came from Northern Virginia. So we've known each other about a year. And then you had a lot of different symptoms, but pretty much most of your life, right?
Yeah, most of my life. I think the earliest symptoms started coming was about 11th grade with like extreme brain fog and all of that. But really it wasn't until my freshman year of college and all throughout college, symptoms kept coming. I went to so many different doctors, like 10, 15 different doctors. They gave me like 8 different diagnoses, and nothing ever fit right. Nothing ever worked with their diagnosis.
What was your main symptoms? Like, what were your top 5 symptoms, would you say?
My top 5 was probably like fainting, like nothing I ate would digest. I'd throw it up, or also really bad brain fog, like I would forget my own name and things sometimes, and like strong dissociation, and also a lot of like full body pain, just different
You're
kinds.
saying you had dissociation? Mm-hmm. Okay, so explain for people who aren't familiar with that term, what does that mean?
It was kind of weird, like I would like detach. It's, yeah, definitely weird.
It's weird, yeah. It's hard to even explain it, actually.
Yeah,
Okay.
right. Yeah, I would it'd feel like almost like an out of body experience. Like my mind was like unattached from my body, and like time would just pass, and then eventually I'd kind of come to myself. But it was just like nothing was there. It's like a blank slate.
Like you're not even you, kind of.
I'm not even me.
And you're not even maybe in this universe or something. Like it's just hard to...
Yeah, it's hard to explain. It's a weird out of body experience.
How did you get through college? Because I saw you a year ago and you just graduated. And then why don't you explain, like, how did you get through college, like having all that stuff? Like,
Truly, I think God got me through it. There's no way I could have gotten through it without His help. I had a lot of professors who were gracious, and a lot of the time I just didn't really know what was wrong, so I kind of just tried to push through. But I don't know, I guess I just kind of made it some long nights and a lot of forgiveness here and there, and I think a lot of grace on God's part.
and then you just graduated. What's your degree in?
Industrial design.
Okay, so explain what that is.
So industrial design is basically, the easiest way to describe it is kind of like the step before you start engineering something. So making sure that products are accessible and easily usable and like business friendly, things like that.
Okay. No, so congratulations on finishing. Then why don't you explain how life-changing getting your neck curve corrected, getting prolotherapy, like how life-changing has it been for you? And then how are you doing now?
It's been amazing. It is actually, I mean, not to be dramatic or anything, but it's kind of like changed my life in like every way. Like I wouldn't have to struggle through a conversation with you right now. Normally I would have to be thinking extremely hard about even the words I'm saying because my brain fog was so bad. Like I can have normal conversations. I can like go out and like I don't feel extremely sick when I work out anymore. I can just like live life. Like I wasn't able to, like I don't wake up in pain every day anymore. Like I don't have extreme insomnia, any of that.
So did the derealization, did that go away?
Yeah, that also went away. Like I don't feel unattached from my body anymore.
And then you were having quite a bit of digestive stuff, right? So why don't you explain, like you said, you couldn't, like you had to throw up a lot and this and that, and then you must have been like bloated a lot and probably nauseated a lot. So how is that symptom?
That's also like completely better. I'm not nauseous anymore. Like I used to be so nauseous every day. I think I threw up every day, sometimes multiple times a day for like 2 or 3 years straight at one point. And now like I don't remember last time I've done that. So
Can you eat pretty much
yeah,
everything?
Yeah, I used to have a long list of things that would like trigger it, like dairy, gluten, eggs, ginger, etc., etc. I can eat anything I want now.
So you're optimistic for your future?
I am optimistic for my future. Before it was like a struggle to get through every day, but I am much more encouraged, and it's just like my life is given back to me.
So we were in the room, then you and I were talking, and then you asked me about running, because, well, why don't we just talk about this? Were you a runner before? Was that your main thing? Was that like your psychotherapy? You just loved running?
I loved running. Yeah. I loved it. It was like my escape. I was like, I would just go out and run for hours. I did like my first half marathon not long ago, or I guess, sorry, 2 years before when I started having these
It's like
symptoms.
3 years ago.
Really bad,
You did
yeah.
a half. Oh, congratulations! You did a
Yeah.
half marathon.
Yeah, and that was really fun. And then after
Okay.
that, symptoms got worse. And
Okay. So you and I, because I don't know if you'll need any more prolotherapy. So I'm going to tell you some things that we actually haven't even talked about, but we might as well just talk about it now. Okay, so because there's going to be people who like have had a remarkable recovery. So you've had a remarkable recovery, and then you've improved a lot in your neck stability. But you and I actually don't know if you're running. We don't know, is it going to be stable enough to handle the forces of running, like, because you haven't tried it, right? So basically the way you start back is you're going to walk for a few minutes, jog very slowly for a minute, just for a minute, and then you use really good form. So really good form is always, and whether you're cycling, you're weightlifting, you're swimming, or you're running, you always lead with your chest. Like, that's proper running form. You always lead with your chest. Because when your chest is up, your abdomen is contracted, your core is contracted, your neck's contracted, right? So, I did a bunch of Ironmans and I did a bunch of marathons back in the past. So what I'm telling you is the same thing that I'm doing. So I'm trying to get back, though it's very, very slow because I sort of lost my mojo with running, even though I love running. So it's the same thing. Like, basically, I'm just jogging for a minute, walking for a few minutes, jogging for a minute, walking for a few minutes. Okay. So if you don't have any recurrence of your symptoms, then all you do is increase the amount of time that you're jogging slowly, and you decrease the amount of time of walking. Like that's then eventually I'll help guide you through where if you said to me, hey, I'm just letting you know I'm up to 15 minutes of slow jogging, right? Okay. So then what we'll do is then it'll be more like this, where you're slow jogging for 3 minutes, then you're doing 1 minute at maybe like 50% of your good running pace, and so that's the safe way to do it, if you want the safe way to do it, versus like go to a running group and see how you do. Because that way, if you have a recurrence of a symptom, it's not going to devastate you. So you got a little bit of a recurrence of a symptom. Does that make sense?
Yeah, I think that makes sense.
Okay, but so even if you're not coming for prolotherapy, you still can, the staff still can help you, if you want help. But that's basically the principle. So I guess anybody who's had instability and they're trying to get back to exercise, you want to do slow and long versus fast and short. Like, because like ligaments, if you do something really, really fast, the ligament may not be able to hold it, and then you could actually injure the ligament. It's very hard if you do slow and long, like an exercise, like I'm saying to you, like you're going to do 1 minute where it's slow, and then you give it a little bit of a rest, then slow. Because you're just not going to injure the ligament that way. But Caroline, anything else you want to say? I mean, were you nervous to first come here and with prolotherapy? I mean, it's a lot of shots. Like how would you tell like people who like are afraid of injections and stuff? Were you afraid of injections prior to coming?
No, thankfully I wasn't too nervous when it comes to shots, but I think the thing that helped me the most, because I think at some point, it can feel sometimes like scary after the first or second time, like, oh, I don't want to go back there. But it's definitely reassuring to know that like everyone here is so welcoming. Like they'll go above and beyond to make sure that you're comfortable, and they're so friendly. And I've never not once felt like welcomed. Like it really does feel like a second home here. So
thank you for saying that.
Yeah, I have loved it here. And even my sister, who is kind of nervous around that stuff, like she's also had wonderful experience. So they'll do everything in your power to help you through if you're nervous with it.
Well, you and I had talked, I appreciate you saying that, because you graduated college, you're feeling better. So what do you think God has for you next? Like, what are you thinking?
I have no idea, but you know what? I think One thing that I've learned through this is that sometimes there's a lot of comparison in our journeys. Like, I never imagined that I would have been like so sick for the past 4 years, and I look at my other friends and I feel like they're so much healthier. Like, they're all this intelligence and they're so much farther in like their faith and all of these things that I compare myself to. And I've come to realize that like, why would I put myself at a pace that's faster than whatever God's plan is for me? So I've learned to trust him, and I don't know what the next steps are, but I know that he's got a plan. So I'm ready to see what he has.
Thank you so much for sharing your story. I'm sure it'll help a lot of people.